right, so there is a special open enrollment period underway right now. It's for health insurance on the Affordable Care Act marketplace. And Spectrum News 13's Sharon Stone has everything you need to know about it.
Joining us this afternoon, Jason Alford, VP of Sales and Business Development at Health First Health Plans. Thank you so much for joining us this afternoon.
Sharon, it's nice to speak with you. Thank you.
Let's talk basics first. With so much debate over the Affordable Care Act, where does it stand now? Are there options for people to enroll that are affordable?
Sure, absolutely. The Biden administration ran on a campaign of increasing access to care and bolstering key aspects of the Affordable Care Act. So the executive order that he signed expanding the open enrollment period here through March the 15th is really signaling the first step in that process. There absolutely are affordable options in the market, and millions of folks, according to the Kaiser Foundation report recently released, really qualify for coverage at zero cost, fully subsidized coverage in the market today.
So we're talking about it happening now. When I think of open enrollment, I think of it at the end of the year. So talk to me about what's different about this open enrollment period.
You're right. So typically November the 1st through December the 15th is the open enrollment period for the individual market. And so that's every year, 45 days every year. And as a part of the executive order, as I mentioned, this is an additional time for folks to find options really in the spirit of the pandemic and people needing extra time and opportunity to reach out to find an advisor, to consider their options. As employers especially are working with their own group health insurance and making decisions, lots of folks are in a position of needing to find coverage. And this extra time period allows people to do that.
So, Jason, let's talk more about who is eligible to enroll. Is this for people who have realized through the pandemic they actually do want health insurance, or is this for people who have lost their job and no longer have it?
Sure, great question. So historically, the individual market is focused on really three parts of the population, typically early retirees who haven't qualified for Medicare yet, part-time folks, contractors, recent graduates, those sorts of folks who are looking for coverage under the age of 65 who don't qualify for Medicare and who are not on an employer-based health insurance plan. But like I mentioned earlier, there are many folks who are in a situation where either their employer is no longer offering coverage, they've been laid off, they're in a new situation of needing to find coverage, so it really expands the market to a wider, certainly a wider audience today.
Okay, let's talk significance, just either local, national level. What is the significance of this open enrollment?
The significance is really a unique opportunity for millions of individuals across the country who are uninsured today to find really affordable and great coverage in their local markets. Really, the number one advice I would offer to folks who are either uninsured or unhappy with the coverage that they have and want to consider their options is really to find help. The premiums for health insurance are the same whether you go it alone and shop for coverage by yourself, or reach out to an independent insurance agent, or reach out to a health insurance company. Highly trained folks who can walk people through very complex decisions about their health insurance, meaning many of the subsidies and the premiums are based upon many different dynamics that are very personal and very individual, based upon the income that folks have, what their employment situation is. So really reach out to an advisor. There's no extra cost, there's no extra premium to do that, the resources that are out there can really help folks make the right decisions.
And just to wrap up, don't want to put words in your mouth, but I'm hearing from you that it sounds like this is maybe something that is necessary for Americans. Do you agree that this additional sign-up period is something that should be happening?
Expanding access to care is always necessary, and especially during a time like this, where there is so much uncertainty and folks are really having to make tough decisions. Historically, people are sitting with insurance agents in their offices, they're face to face. They're making decisions that they're having to change the way they do business today. So I absolutely see it as a unique opportunity for folks to protect their families, to make valued decisions during a pandemic, but just gives folks an extra opportunity to find the right coverage at the right time. And it's a really unique opportunity in the market today.
Okay. Jason Alford, VP of Sales and Business Development at Health First Health Plans. Thank you so much for your insight and going in depth with us.
It's great to speak with you. Thanks a lot.